Here. All right, good morning. It is January 22nd. Amazingly, every day it feels amazing. And this is Senate Health and Welfare. So today we have a little bit of time for committee discussion, and then we're going to move on to looking at some basic information regarding the Blueprint for Health, just to get an understanding of primary care in the state. The significance of that. I'll mention that a little bit later again. But I did want to call your attention to the reports that we have gotten in committee, and we have a request on the part of Ledge Council to go through those reports, and I did that the first time. I went through the 13 pages, and then I talked with Ledge Council and received some help in triaging what I've done. So now I'm going to go through those reports again. And then I will share with you what I think we might want to do with the report that we have in committee. So some of them are, old reports that we keep getting annually. And do we still need them? Or can we can we cancel the reports and just suggest that we'll get the information upon request? There are quarterly reports that we get. Maybe we can lengthen that time out. So I'll look at that and then bring it back to you. Some of the reports are probably less important to us right now. Some are more important. I'm going to be doing that. Again, going through 13 pages of reports. It was exciting.
Oh my goodness.
No, it's down. No, but Jen has whittled it down to 5 pages, which is good.
Wow.
Yeah. So there are some reports, for example, the reports that we asked for last year in Act 68. We don't want to cancel those right away because they're term limited, right? And unlike us. And then there's reports that we've been getting for years and years and years. And some of them are triannual, some of them are, biannual. What is it, biannual or biennial? When you get it every other year.
Biennial's twice a year, right?
It's biannual twice a year? What's biennial? How do you say you get it every other year?
Just like twice a year.
Huh?
Just like that.
Right.
Every other year.
It's both. It should be either every other year or twice a year. It's the most confusing.
Biennial is twice a year. By
Or
It's twice a year.
It can be either. Right?
yeah,
either.
what's the worst? Like,
This is important to remember.
All of the outside from the agreement, it can be neither.
oh,
No.
Every
oh,
biennial.
That's what I said. Yeah, biennial. That's what I thought. Okay, so we'll.
When will we?
Yeah.
Go through all that? Like, when will we be able to hear your final?
Are you asking me how quickly I'm working on this?
No, in a couple of weeks, like in a couple of weeks or.
No, I'm gonna try to do it quickly. I did the 13 pages on Tuesday, and I'm gonna try and do this. Maybe I'll do it soon.
Anything we can do to ease the burden of the people doing the work, I think would be great.
I completely agree. Yeah. I think that I've heard comments that all some people do is write reports, and the reports are useful to us. In fact, I really do rely on these reports, but really always we don't need. Okay, is there any way we could find John Sugarland? Is he out?
He's right. He said he's right out in the hall. I could be in a minute.
Okay.
Oh, I can't.
And I think we can move ahead.
If you give up your seat and never get back, so.
And then the bills that we've been working on will continue to bring in testimony. So if folks, especially you folks who are in the room now, if you know specific representatives who can speak to the bills we're looking at, so I like to know, what is the person actually doing the work? Think about how we could improve the bill. That's what I really want to know. So I say, you know, the chamber is here. If you have a business owner or an individual who will have something to say about any one of the bills that we have, I would really like to hear that. If we have a primary care doc out there who wants to speak, that would be good. A hospital administrator, and I'm, you know, just going down the line, if there are people who are actually in the community doing the work, that would be helpful. Whomever you represent. It's one thing to hear from the whole organization, but it's another thing to hear the effect, in the office. Or whether it's a patient, a practitioner, or someone who's paying for insurance. And if you have something that would be good too. Oh, record. So we're starting a little early. If you can take a seat up here, did you want to bring anyone else with you, John?
Good morning. Dr. Armstrong is supposed to be here with me and
Well, it's 20
yeah,
minutes
let's start.
early.
yes. I think she'll be here
We
momentarily.
can take a
So
break
we need
until she's here, if you would prefer that.
to- If could it be a short break?
Yeah,
I don't want
let's
to
do
delay
that.
you, but
We're-
it's just unusual for her not